The newly released U.S. government study examining early-onset cancer provides a timely and hopeful opportunity to understand and address rising cancer rates among people under 50 with greater clarity and scientific rigor. While the increase in cases of breast, colorectal, kidney, and uterine cancers does raise valid concerns, this comprehensive analysis represents a significant step forward in the national conversation on cancer prevention, early detection, and health awareness in younger populations. The study, published in Cancer Discovery and based on data from over 2 million cases between 2010 and 2019, offers not only a more complete picture of cancer in younger adults, but also an invaluable foundation for shaping smarter public health responses in the years ahead. Understanding the scope of the issue is the first step in designing effective solutions, and in that regard, this research is a breakthrough. The findings help move the narrative beyond anecdotal reports and regional observations to a nationwide, data-driven understanding of how early-onset cancers are evolving across demographics. That alone is a reason to be optimistic, because the more precisely we understand the patterns of change, the better we can tailor both preventative and diagnostic strategies to those who need them. While it is true that cancer in people under 50 is increasing in certain types, notably breast, colorectal, kidney, and uterine, it's important to recognize the many positive elements within the data. For example, overall mortality rates for most of these cancers remain stable or are even declining, a powerful indication that advances in treatment, awareness, and early detection are already having a meaningful impact. In fact, declines in death rates for most early-onset cancers show that the healthcare system is increasingly capable of catching and treating these diseases before they reach the most dangerous stages. Another encouraging sign is that for more than a dozen cancer types, rates are actually decreasing in people under 50. Lung and prostate cancers in particular have shown the most significant declines. These drops are likely tied to successful public health campaigns, including reductions in cigarette smoking and more refined screening protocols, which demonstrate that proactive, targeted interventions can and do work. This serves as a reminder that collective action, informed by science and policy, remains one of our most powerful tools in the fight against cancer. The study also sheds light on some of the social and behavioral changes that may help explain shifts in cancer incidence. For instance, the trend of women having children later in life is noted as a possible factor in increased breast cancer diagnoses. But this also opens the door to more nuanced research into how reproductive health, hormonal factors, and lifestyle decisions interplay with cancer risk, knowledge that can empower individuals to make informed choices and encourage healthcare providers to tailor their advice accordingly. Moreover, while obesity has been suggested as one of the contributors to certain cancers, this connection provides a clear target for public health efforts. By focusing on diet, physical activity, and metabolic health from earlier stages in life, we have a tangible and controllable avenue for reducing risk. The link between excess body weight and cancer underscores the broader value of preventive health education, not just for cancer, but for cardiovascular and metabolic diseases as well. It gives individuals something actionable, not just alarming, and strengthens the case for long-term investment in wellness promotion. Perhaps one of the most exciting opportunities that comes from this research is the ability to rethink how we approach screening and surveillance. As our understanding of cancer shifts to include its impact on younger adults, guidelines can adapt accordingly, potentially leading to earlier diagnoses and better outcomes. With increasing technological capabilities, from genomic testing to AI-enhanced diagnostics, the path forward includes not just more screening, but smarter, more personalized screening that minimizes harm while maximizing benefits. Importantly, the presence of this study in public discourse also helps dismantle the outdated notion that cancer is a disease that only affects the elderly. By bringing visibility to the experience of younger adults with cancer, it creates space for more supportive policies, research funding, and social support systems for those navigating the disease in the midst of family building, careers, and other formative life stages. The fact that a major conference is being planned to bring together experts from across disciplines signals momentum. Collaborative dialogue will allow scientists, clinicians, public health officials, and patient advocates to converge on real-world strategies that can reduce incidence rates and improve care outcomes. The scientific community's rapid engagement with the data demonstrates how seriously this trend is being taken and how motivated stakeholders are to use this knowledge to enact change. Finally, this research underscores the essential role of data in guiding healthcare evolution. With more detailed and timely analysis of cancer patterns, we can break away from reactive medicine and move into an era of predictive, personalized, and preventive care. Early onset cancer doesn't have to be a mystery or a crisis. With the right tools, insights, and coordinated efforts, it can be managed, mitigated, and in many cases, prevented altogether. What we are seeing is not a reason for fear, but a call to focus, a reminder that our understanding of cancer is constantly growing, and so is our capacity to respond. In the end, this new study offers not just information, but direction. It brings light to an emerging challenge and, just as importantly, reveals the many levers we can pull to protect future generations from its most serious consequences.